Heart failure can become a big problem later down the line. There can be a lot of symptoms that can easily be identified early on. So join us today as we discuss the most common signs of why your heart may not be functioning properly. A vital component of the human body's circulatory system is the heart. Most individuals with heart diseases either have it from birth or develop it over time. A failing heart can lead to potential fatal issues. Heart failure is a condition in which the heart is unable to pump blood normally. Coronary disease, where plaque deposits in the heart's two coronary arteries. Blood flows to the brain during strokes and heart attacks where the heart's blood supply is either partially or fully interrupted. Many people have died as a result of these heart problems in many nations. If the significance of heart health isn't already abundantly evident, let this one number do the heavy work for your heart disease in the leading cause of death in the United States, accounting for 600,000 fatalities annually, besides COVID in any age group. One of the most essential steps you can take to ensure your welfare and long happy life is to pay attention to the health of your heart. Before we continue, a brief request from us. If you find value in this video, please don't forget to subscribe and hit the notification bell so that you don't miss our valuable content on health in the future. Now off to the common signs your heart may not be working properly. Number 1. Difficulty breathing or shortness of breath. Most individuals don't perceive the involuntary inhaling and exhaling of the lungs. This is a sign of them working normally, unlike the heartbeat. But when it stops operating correctly, it's quite obvious. Shortness of breath is the experience of ineffective breathing. The patient can experience heavy breathing or the need to breathe quickly and shallowly. Although anxiety, anemia, or allergic reactions can induce shortness of breath, the underlying reason is typically pulmonary or cardiac. The first sign of a dangerous pulmonary embolism may be unexpected shortness of breath. Sometimes breathlessness comes on gradually. It could be a symptom of heart failure, arrhythmia, or aortic disease. Lack of breath, whether sudden or gradual, is nothing to take lightly. Number 2. Irregular heartbeats. An arrhythmia, an abnormal heartbeat, is a form of heart illness in and of itself. All arrhythmia symptoms, no matter how little, should be addressed seriously, because while not all arrhythmias are harmful or a sign of a significant heart problem, many of them have the potential to be. Some types of arrhythmias could be obvious. There are numerous types of arrhythmias to be aware of. The following are just a few to watch out for. Atrial fibrillation. If the heart's electrical system malfunctions, the heart may pulse up to 300 beats per minute quicker than usual. The risk of stroke in those with atrial fibrillation can be significantly decreased with the right medications, but only once the condition has been identified. Since most cases of atrial fibrillation have minimal or no symptoms, screening is quite important. Also, keep an eye out for atrial flutter. It is a different kind of rapid pulse that is less severe but a significant risk factor for stroke. Number 2. Premature ventricular contractions. Heart disease may be present if your heart repeatedly, quote-unquote, skips a beat. Ventricular fibrillation. This condition causes the lower heart chambers to beat too quickly. Because the electrical signals inside your body's organs are jumbled, the ventricles of your heart contract inefficiently and erratically. This is extremely dangerous and needs urgent medical assistance right away. Number 3. Sleeping and snoring problems. When someone has sleep apnea, they may gasp for air as they awaken, which disrupts their sleep patterns and creates insomnia. High blood pressure, a stroke, or heart failure may be to blame for this. Sleep apnea comes in two different forms. Most commonly, obstructive sleep apnea occurs. It takes place when your muscles relax while you're sleeping, resulting in soft tissue collapsing and blocking the airway. However, you are unable to breathe. Instability in your body's breathing control mechanisms leads to central sleep apnea. During sleep, your body quits trying to breathe. Number 4. Puffy feet and legs. Taking off your shoes at the end of the day to find swollen legs and feet could indicate heart failure. An early symptom of a pulmonary embolism, deep vein thrombosis, may be indicated by swollen feet. A sign of cardiac failure could also be present. This is a result of gravity drawing blood into your lower extremities during the day as the heart starts to pump less effectively. So the next time your socks, shoes, or jeans start to feel constrictive, heart failure should be taken into account. The following sign could be a blood clot that causes a heart attack or cardiac arrest. Number 5. Never-ending fatigue. Fatigue is a common symptom of many diseases, including the flu and bacterial infections. However, as the body becomes oxygen depleted, never-ending fatigue is a classic indicator of heart failure. Watch out in particular for any sudden or gradual rise in the difficulty of routine chores that used to be quite simple. If you start experiencing extreme exhaustion without your lifestyle having changed much, then it is a good idea to pay a visit to your general practitioner. Number 6. Lightheadedness and dizziness. If you faint or feel lightheaded, it may be an indication that your blood supply to the brain is restricted, or that your blood pressure has dropped. This can lead to heart attacks and strokes. A shortage of blood flow to the brain or decreased blood oxygenation may be the cause of the brain's inadequate oxygenation. This might be the result of heart failure, valve problems, or atherosclerosis. Given that gravity draws blood closer to the ground and that the heart must work harder to pump blood to the head and then to the feet, feeling lightheaded upon standing up is a common sign of heart disease and blood pressure problems. Dizziness and lightheadedness are early signs that something is wrong if the heart can't pump that hard. Number 7. Sexual function difficulty. The inability to maintain an adequate erection for sexual activity, also known as erectile dysfunction or sexual dysfunction, has a link to cardiovascular diseases. There are numerous potential causes of erectile dysfunction, and medicine is an effective treatment. However, people should consider the likelihood that difficulty, quote-unquote, performing may be an early sign of coronary artery disease, especially in males with additional risk factors like diabetes, excess body weight, family history, and other symptoms. This prevents the blood arteries from dilating correctly. It is one of the early indicators of coronary heart disease. This impact frequently manifests itself first in the penis's erectile function. Treating the symptom is important, but you should also think about the potential that the real problem is not a dwindling libido, but might be a heart disease. Number 8. Cold sweat. Sweating happens frequently and is healthful by nature. When you are not physically active, cold sweats may result from a heart condition. In this case, the sweat will be released to reduce heart inflammation. A heart attack may be imminent or is now underway if you have a cold sweat in addition to other heart attack symptoms. If you experience cold sweat coupled with other symptoms, seek urgent medical care immediately. Last on our list, number 9. Heartburn, stomach pain, or back pain. People should pay close attention to any chronic stomach, back, or heartburn pain, especially in women. These illnesses are brought on by a variety of events, but for unclear reasons, women are considerably more likely to have cardiac problems such as heartburn, stomach aches, or back aches, including the early warning signs of a heart attack. The illness could deteriorate and move to the chest or left shoulder, which are more typical symptoms of a sick heart. As we conclude, we would advise anyone experiencing some of these signs listed to get checked for heart health indications. Even people with lifestyle choices that are favorable to heart health may be especially sensitive to heart disease owing to genetics or other factors. It may seem fanciful, but this is a case of better safe than sorry. That concludes our video on the most common signs of an unhealthy heart. Be reminded that this video is primarily for information only, and we do not claim to provide medical advice that is tailor-suited to your needs. Be sure to consult with a medical professional and seek personalized healthcare that will fit you. Additionally, leave a like, subscribe, and click the bell button to receive information on our new health-related videos. If you want to watch more of our content, check out this video in the lower right corner. You can also check out our playlist of related content. Anyway, see you later and thank you for watching.